Hello Indigo family, I'm here today to show you how to complete the Doctor's Data Neurohormonal Test. You'll receive this test kit either in the mail or in the office. Always want to double check on the box that it's the right name of the test and the expiration date is appropriate. You're going to take the box and you want to open it up and make sure you have everything inside. In the first part, you have the requisition form, which looks like this, a questionnaire, like this, instructions, and a FedEx envelope with a prepaid label that you will use to ship your sample back in. Then there is a white styrofoam box. Inside the white box, you have two bags, one for your urine sample and another bag that has your saliva samples in it, and a frozen an ice pack. First thing you want to do is when you get home is put the ice pack in the freezer. Separately, you'll also receive a plastic cup to collect your sample in, or if you don't receive the plastic cup, you can use any clean cup you have at home. So like I said, as soon as you get your package, put the ice pack into the freezer. Read all of the instructions that come in the box. You want to make sure you fully understand what you're doing. You're going to be doing a saliva sample as well as a random urine collection. So this will be the first or second morning void of your when you wake up, and not a 24-hour collection. So when you read the directions, you'll see that 2 days before and during your collection, you have to avoid avocados, eggplant, tomatoes, bananas, melons, pineapple, grapefruit, plums, fruit juice, nuts, nut butters, wine, cheese, rice, and chocolate. And then 1 day before and during the collection, no strenuous exercise, alcohol, coffee, tea, and caffeinated beverages. If you're someone that has caffeine every single day, that is something that you can continue during the test, because we'll look at what your baseline is. So also ask your doctor if you have any questions about stopping any medications. You should not use any hormonal or steroid medications, including creams, before the test. For women, you're going to collect your sample on 1 day between the 19th and 23rd day of your menstrual cycle. Day 1 is the first day that you start bleeding. So on the day of the collection, you're going to fill out the requisition form and the questionnaire, and the requisition form. All the instructions to fill out the requisition form are on your treatment plan, very detailed, so please follow those directions to make sure that there are no problems with the sample and samples don't get returned. So on the white top 2, there is a place for your name, the date of collection, and your date of birth. You can use a small fine tip Sharpie or any sort of pen or something like that. Then you're going to write your first name, last name, date of birth, and the date of collection on the other bag, and you'll fill in the rest as you go along. So like I said, when you, for the urine sample, when you wake up in the morning, you're going to collect either the first or second void of the day. You want to collect midstream, so this means you're going to go to the bathroom a little in the toilet first, and then collect. So pour the urine from the cup into the vial right to the fill line, and close the vial tightly and just rock it back and forth a few times just to mix everything up. Put the urine back into the plastic bag and put this in the freezer, and it has to be frozen for at least 4 to 6 hours before shipping. For the saliva collection, do not eat or drink anything 1 hour prior to each collection. Do not brush or floss 30 minutes before each collection. As soon as you wake up in the morning, you're going to set a timer for 30 minutes. Don't do anything. Don't eat, brush your teeth, drink water. 10 minutes before the timer is up, you do want to wash your hands and swish a little water around in your mouth. Don't drink it, just a little water. Then inside this bag, There are 4 different colored tubes corresponding to each time of the day, as well as 4 straws that you'll use to help you spit into the tube. The first tube that you're going to use of the day is the pink one. So you're going to use the straw included to spit into the funnel about 3/4 of the way. Sometimes you kind of have to like swish your mouth around a little bit to help get more saliva to help fill it up. Then you're going to snap the tube, make sure it snaps tight and it's really closed. Put it in the freezer and write the time that you did the collection on the bag. So you're going to follow the same instructions above when filling the green tube, which will be around noontime lunch, and then the orange tube, which will be around dinner time, and then the blue tube is right before bed. Before each sample, you want to do that 10 minutes before, just rinse your mouth out a little bit. After each sample, make sure it goes into the freezer. The next day, you are going to collect both of the bags that you have filled from the freezer. Take the freezer pack that also came from the freezer. Put it into the styrofoam box. Then you're going to take your questionnaire and your requisition form that are fully filled out and put them into the side of the box. Close it up. Take your FedEx envelope, put it inside, and then adhere the label onto the front of the bag. You want to make sure that you either take this to a FedEx location or call a FedEx representative and ask them to come and pick up the bag. Don't put it in a drop box. Sometimes the drop box is not continuously monitored. And if your sample is sitting for too long, it may not be viable by the time it gets to the lab. So I hope that helps. If you have any questions about doing the test, I would give the lab a call. They are the experts on how to do it. Or you can always call us and we can do our best to guide you further. All right, hope that helps. Have a good day.